I'm Joyce from Allenton, Wisconsin. Tell you a little bit about my experience with Gardner Schofield. I've had pinched nerves and knots for probably over 30 years. I first started going to the chiropractor, and he did help me. But after a while, he said there was really nothing that he could do. So then I started going to physical therapy. I tried that. I tried needling. I tried different types of painkillers, and I still wasn't getting any help, and it was getting worse. So about 2 years ago, I had a fishing trip planned, and I knew that this would not work. So I got desperate, and I went to the phone book, and I remember reading an ad about Gardner and Schofield in the paper. So I thought, okay, I'll give this one last chance. So I made an appointment, and he assured me that he could take care of this. And I was a little doubtful as to his practice and whether this would really work, because I had gone through so many other things. Well, I went 3 times before I went fishing, and I was able to fish all week long. I've never, ever had that type of pain relief that quick. And I've been going since then. I'm not saying it's completely gone, but it doesn't happen nearly as often. And when it does, I can usually come in with maybe 1 or 2, 3 visits at the most, and I don't have any pain anymore. I'm not taking pain pills. I can do my basic activities. I'm very, very pleased with the results that I've got. I haven't gotten that from any other type of method that I've tried. And I was almost to the point of just giving up and feeling like, well, this is just something I'm going to have to live with. But it didn't work out that way. And I'm continuing to go to him, not as often as I used to, because I don't need the treatment. But when I do go in, like I said, it helps, and I am pain-free for anywhere from 6 to 8 weeks, and not have to deal with those knots and those terrible, excruciating pain that I had before. So I don't know if it works for everybody, because it's very, very different. I was very skeptical when I first came in, because it's very different than a regular chiropractor. And I just kind of laughed at him and said, I don't know if this is going to work, but it did. So if you're having pain and you've gone other routes, this would certainly be worth your time. Thank you.
So this is Joyce's pre and post x-rays after the alignment correction. The way I like to do my visit flow is I have patients come in, we do their consultation, we take x-rays, evaluate their alignment, and then they come back and I go through the x-rays with them. We make sure there's no congenital malformations or anomalies that would prevent correction. They're rare, but they do happen. Then I tell them, based on their history, how much pain they're in, how much degenerative damage, how bad their misalignment is, how long they've had their problem, what I think it's going to take to get them fixed, to get it corrected. And most people choose to do it. Some say it's not a good time to do it. And then we get them an adjustment that visit to just hopefully get them some relief. And then we set them up for what's called the alignment correction. So this visit is about 2 to 6 hours. And this was a Joyce's alignment correction. The difference we made, I had to adjust her for about, they come in, I always do the nasium and this is what we're looking at, a nasium x-ray, and also do a vertex where you look at the top of the neck. Always at that visit again, because I want to see exactly where they're at that moment. Then we adjusted her for about a half hour. Her legs went balanced, her shoulders leveled out, her head tilt improved, so all her posture was good. So then we took an x-ray. And this is what it looked like. And this is textbook. So when you get a correction like this, you will see NUCCA and upper cervical chiropractors just, you'll probably see them cheering, jumping up and down. It's like you just hit a game-winning shot. That doesn't always change this much, this nicely right away. But she went on the left here, you can see her atlas lateral value was 3.38 degrees, so well over 3 degrees. Her head tilt was 1.92 degrees, so almost 2. Her lower angle was over 7 degrees, which is a ton. 3 degrees is considered a lot, so 7 degrees is a lot. And her plane line was 6.6 inches. So after the adjustment, we re-x-ray. She went to 1.27 degrees. Lower angle went to 2.55. Plane line went to 1/16, and head tilt went to 0.49. So when you get this, you know you've improved the musculoskeletal system alignment. So they're going to move, sit, stand in gravity better. So there'll be a lot less pressure on the neck, mid-back, back, less pressure on the hips, knees, ankles, less pressure on the shoulders, elbows, wrists. You've taken pressure off the brain stem. So the nervous system is going to function better. And that's how the studies have shown blood pressure comes down, vertigo will get better, insomnia, fibromyalgia, neuropathy, the allergies, asthma, all kinds of issues you wouldn't typically associate with chiropractic care. And it's the specific and the precision that allows that to happen. So we know we fixed it. She's not absolutely perfect. You don't see a bunch of zeros, but we fixed it. We got her to her normal. Now we got to hold it there. So then we set up regular checkups afterwards to make sure she's holding. Then what I will do is I'll also use some other techniques, work on soft tissues, minor adjustments to the rest of the spine to help the rest of the body uncoil and heal. And then you can imagine in the beginning, muscles and joints are used to being out of alignment. So it's a lot easier to lose your alignment in the beginning. So we check her. When she goes out of alignment, when the head goes off, the leg goes short, we adjust her at exactly the same vector to put her back. The alignment will always go out of alignment the same way unless you have a new trauma, 10 pounds of force or more to the head, neck, or back to change it. And the reason for that is your soft tissues use a different material to heal than to create. So even when you heal in alignment, you only regain about 50 to 70% of your tensile strength. So your body will always go out of alignment, give the same way. So when she comes in, we're going to check her head tilt, check her standing posture, check her leg length and her posture on her back, and we'll give the exact same adjustment. And when she needs to be adjusted, the follow-up adjustments, as long as she's fairly regular, will be much, much quicker. And eventually we'll get her to the point where, it may take a while, but we'll get her to the point where she will hold her adjustment for months and months. And by doing that, you can prevent future flare-ups. You can prevent the symptoms from coming back because you keep the body in alignment. You allow it to hold. And when you hold, you heal. And that's how you can help people completely get rid of their problems. Now, you have to be a lot more regular in the beginning. Usually the first 90 days, you see people twice a week, once a week, and then every other week, lots of times. But then once that is healed, after that, lots of times people will go months and months, and they will hold their alignment, and they'll feel great. And it's just a very powerful, very precise way to practice. And this is why I love NUCCA and upper cervical chiropractic. Hey guys, Dr. FJ. So when we check patients, we take the x-rays always, we analyze the x-rays, and then you're also looking at posture. So with Joyce, we know she needs to get adjusted. Her shoulder is low, her left shoulder is low, and her ears are off. So when your neck goes out of alignment, your shoulders will go off, your head will go off, and your hips will go off. So next we're going to check how to go on your back. So this is a supine leg check, and if you want to bring it real close, you can see, let me see how her left heel is shorter than her right. So the left leg's shorter than, let me bring it up top here. The left leg is shorter than the right, so we know she needs to get adjusted. We can edit out some of that. But, okay, so you can see, Joyce, I'm going to have you sit up facing that way. So with the adjustment, her top of her neck is kicked up into the right. We know that from the x-ray. I'm going to have you slide up and lay on your left side. So how we position her, everything is based on the x-ray. So now we're going to do a hand adjustment. It's very light, just a few grams of pressure. Feels like almost nothing. In the beginning, the first time we do a neck correction, an atlas correction, I may adjust for 10, 15, 30 minutes, 40 minutes to break all the tension, resistance in the spine and get the body into alignment. And as people come in, it happens much faster. So we get the measurement. Again, all from the x-ray. Come down.
can turn it off for a minute for a little. Oh, no.
Okay, so next we look at the legs after the adjustment, and you can see that the left heel is, the legs are balanced. Now I know it seems a little crazy, or maybe I'm moving the feet or whatnot, but all that is controlled by the upper neck, the brainstem, the head positioning. So when you unkink the neck, the hips will naturally balance. Doesn't always get perfectly level, but that is pretty darn level. So we know there's been some positive change in the body. Muscles have released, joints are going to be under less pressure, nerves will be under less pressure, and our body will walk and move in gravity in a more balanced and effective way. Okay.